Good day, everyone. My name is Armikisha Meharstrap Singh, and my partner is Noella Zaira Galero. And today we are going to be talking about asthma and the status asthmaticus. So first, what is asthma? Asthma is a chronic inflammatory disorder of the airways characterized by variable and recurring symptoms, airflow obstruction, and bronchial hyperresponsiveness. According to the Global Initiative for Asthma, which is the GINA, it affects approximately 262 million people globally and is responsible for around 461,000 deaths each year. So the status asthmaticus is a severe form of asthma exacerbation where the patient experiences prolonged and severe respiratory distress that does not respond to standard treatments. So, asthma, it is a chronic respiratory condition which is also characterized by inflammation of the airways, leading to symptoms such as the wheezing, shortness of breath, and also chest tightness. It affects millions worldwide and can significantly impact quality of life. A severe complication, which is said earlier, is the status asthmaticus. It is a life-threatening exacerbation where patients experience prolonged respiratory distress that is unresponsive to standard treatments. So this condition requires immediate medical intervention, highlighting the importance of effective asthma management and awareness of potential triggers to prevent severe episode. So now let us proceed to the prevalence of the disease. So, asthma is a significant public health concern worldwide, characterized by chronic inflammation of the airways leading to difficulty in breathing, wheezing, coughing, and chest tightness. So, here's an overview of asthma prevalence. So, in the global prevalence, worldwide estimates approximately 262 million people are affected by asthma globally according to the World Health Organization. So next is the mortality. Asthma contributes to around 461,000 deaths annually. So asthma is a widespread chronic respiratory condition that is said that it is affecting 262 million people globally. So the high prevalence and potential severity of asthma, especially in forms in like status asthmaticus, highlight the importance of ongoing research and public health initiatives to improve care and reduce mortality.
Now let's discuss the signs and symptoms. So there is a differences between typical asthma symptoms and those experienced during a severe episodes called status asthmaticus. So for the common signs and symptoms of asthma, first we have the wheezing. A whistling sounds during breathing, often heard when exhaling. So second is the shortness of breath or dyspnea. Difficulty breathing, feeling like you can't get enough air. Third is the chest tightness, a constricting feeling in the chest, making it hard to breathe deeply. Fourth is the coughing, particularly at night or early morning. So there is a persistent cough, often worse at night or early morning. In status asthmaticus, symptoms may escalate to severe respiratory distress, including the wheezing, or more pronounced and persistent wheezing compared to typical asthma. So second is dyspnea or severe shortness of breath, making it difficult to speak or perform simple tasks. And third is the chest tightness or intense chest tightness, feeling like your chest is being squeezed. Fourth is the severe shortness of breath or extreme difficulty breathing, requiring immediate medical attention. And the fifth one is the non-productive to productive cough, a dry cough that may become productive, bringing up mucus.
So now we are going to be talking about the laboratory and diagnostic testing for asthma and status asthmaticus. So first is the pulmonary function test. So Pulmonary function tests are essential in evaluating lung function, especially measuring two key parameters. So these two key parameters are the forced expiratory volume and then the forced vital capacity. So the forced expiratory volume measures the amount of air person can forcefully exhale in 1 second. A reduced FEV1 indicates airflow obstruction, which is common in asthma. And next is the forced vital capacity that measures the total amount of air exhaled after taking a deep breath. The ratio of FEV1 to FVC helps determine the severity of the obstruction. So next test is the peak expiratory flow rate. This assesses how quickly a person can exhale air after a maximal inhalation. It is a useful tool for monitoring asthma control and detecting early signs of an exacerbation. Patients can use handheld peak flow meters at home to track their lung function regularly. So next is the arterial blood gases. So this measures the levels of oxygen and carbon dioxide in the blood. This test is particularly valuable during severe asthma exacerbation to assess the effectiveness of lung function and determine if there is oxygen deficiency or excess carbon dioxide retention. So ABG results can guide treatment decisions such as the need for supplemental oxygen. The next is the chest X-ray. So a chest X-ray is performed to rule out other potential respiratory conditions that may mimic asthma symptoms such as pneumonia, pneumothorax, or other lung diseases. While chest X-rays are not diagnostic for asthma itself, they help ensure that the symptoms are not due to alternative causes. So these diagnostic tests are critical in the comprehensive evaluation of asthma, helping healthcare providers assess the severity of the condition, monitor treatment effectiveness, and rule out the respiratory issues. Regular monitoring through this test can significantly improve asthma management and patient outcomes. So now let us proceed to the treatment algorithm. So first is the initial assessment. So during the initial assessment, we are going to assess the symptoms if it is mild, moderate, severe, or if it is life-threatening. So in mild, it shows minor symptoms and still has good airflow. So next is the moderate, where the patient has noticeable symptoms and some airflow limitations. And in severe symptoms, you can observe significant airflow limitation and potential for respiratory failure. And next is the life-threatening symptoms, and it can show signs of respiratory distress, altered mental status, and also cyanosis. So next is the immediate management, where the oxygen therapy, short-acting beta agonist, systemic corticosteroids are in there. So first is when the oxygen therapy. So first, you're going to administer oxygen to ensure oxygen saturation remains above 90%. This is crucial for preventing hypoxia. Next is the short-acting beta agonist. You're going to use medications like albuterol via nebulizer or metered dose inhaler to quickly relieve bronchospasm and improve airflow. And next is the systemic corticosteroid. So you can administer corticosteroids, for example, the prednisone, to reduce airway inflammation and improve recovery time. So these are the immediate management you can do for emergency settings. So next for the treatment is the monitoring. Continuous monitoring of the vital signs, which includes the heart rate, blood pressure, and the respiratory rate, and then the respiratory status, the breath sounds, and how the breathing works, and then the arterial blood gases to assess oxygenation and acid-base status. So next is the advanced management where the adjunct therapies occur. You can consider additional medications like epratropium bromide, which can provide further bronchodilation. So if unresponsive to these adjunct therapies, you can use magnesium sulfate, which can help relax the smooth muscles in the airways. And then the heliox therapy, a mixture of helium and oxygen used to improve gas exchange and reduce work of breathing in severe cases. So after all of that, you're going to conduct reassessment to see if your previous diagnosis or nursing interventions work. So regular reevaluation, you're going to continuously assess the patient's response to treatment, and then ICU admission consideration. If there's no improvement or if the patient's condition worsens after the treatment, consider transferring to the intensive care unit for more intensive monitoring and treatment. So for the summary of it all, this algorithm emphasizes a stepwise approach to managing respiratory distress, starting from the initial assessment to advanced management and reassessment.
There is various approaches to managing the asthma, categorized into medical, surgical, and pharmaceutical intervention. So let's focus first on the medical management. We have the bronchodilators. So this medication help open up the airway by relaxing the muscles surrounding them. So also we have short-acting beta agonists. So example for these are albuterol. So it provide a quick relief for acute asthma symptoms. Third is the long-acting beta agonist. It provide a longer lasting relief and are often used for maintenance therapy. And the fourth one is the corticosteroid. So this medication reduces inflammation in the airway, helping to prevent asthma attacks. So they can be taken orally, inhaled, or intravenously. So now let's proceed to the surgical management. So for surgical management, we have bronchial thermoplasty. So this procedure uses heat to reduce the smooth muscles mass in the airway. So it is considered for severe persistent asthma that is not controlled by medication. And now for pharmaceutical management, we have the leukotriene modifier. So these medications help reduces the inflammation and bronchoconstriction in the airways. And also we have the immunotherapy. So this approach is used for patients with specific allergies that contribute to their asthma. So it aims to desensitize the patient to the allergen, reducing their allergic response.
Now, let us proceed to the nursing management. So, during this time, first thing that a nurse should do is the assessment, where they are going to assess the monitoring of the respiratory status, the vital signs, and the signs of distress. So during the monitoring of the respiratory status, the nurse is going to regularly check the patient's breathing patterns, lung sounds, and oxygen saturation levels. So this helps identify any worsening of their condition. Next is the vital signs, where the nurse measure heart rate, blood pressure, and temperature to gauge overall health. So changes in this can indicate stress or other complications. So next is the signs of distress, where the nurse is going to look for signs such as increased work of breathing, use of accessory muscles, or changes in mental status. This can signal that the patient needs immediate attention. So one of the nursing management is the education, providing education to the client. So recognizing early signs of exacerbation, and then the proper inhaler techniques. So teach patients to identify symptoms like increased shortness of breath, wheezing, or changes in sputum. So early recognition can lead to timely intervention. Next is the proper inhaler techniques, demonstrate how to correctly use inhalers, including proper timing, technique, and maintenance. This ensures effective medication delivery. So, next is the supportive care. The nurse can also provide supportive care such as comfort, reassurance, and calm environment. So the nurse can create a comfortable environment by adjusting room temperature, providing pillows, or assisting with positioning to ease breathing. Next is the reassurance, offer emotional support to reduce anxiety. Calm demeanor can help the patient feel more at ease. And next is the calm environment. Minimize noise and distractions. A serene setting can help prevent exacerbations triggered by stress. And next is the crisis intervention. So if crisis occurs, the nursing intervention that the nurse can do is to administer rescue medications. So be ready to provide bronchodilators or other emergency medications as prescribed. Knowing when to use this is crucial during an exacerbation, and then you can also provide an emergency care. Familiarize yourself with emergency protocols, including when to call for advanced medical assistance. So being prepared can save lives. So each of these components plays an essential role in managing patients with respiratory conditions, ensuring their safety and promoting better health outcomes.
So for the prognosis for individuals with asthma varies based on several factors, including the severity of the disease, adherence to management plans, and the presence of comorbidities. So most patients can achieve a good control with appropriate management, but status asthmaticus can lead to life-threatening complications if not treated promptly. So regular follow-ups and educations are key to improving quality of life and preventing severe exacerbations.